So I thank you, and welcome you to the webinar. My name is Linda Romano, and I am the Vice President for the Health Science Division. And I've met some of you in person in Anaheim and in other vision conferences and our HOSA luncheons. And for those of you that I don't know, I am so grateful that you are here. And I hope that all of you are well. And please know you are all in my prayers and thoughts. I just pray for everyone to get through this healthy and all of that stuff. With that said, I am going to welcome our two panelists, and we have Dana Stringer, and she's from HOSA. She's the Board of Director, a Chair-elect, and we have Nancy Allen from the National Consortium for Health Science Education, Executive Director. So Dana, if you would please unmute and tell everyone about yourself.
Hi, I'm from Alabama. I'm with the Alabama State Department of Education. I'm an education specialist for health science. I'm also the chair-elect for HOSA Future Health Professionals. I am a past health science instructor of 15 years, a HOSA alum of more years than I want to tell you, a nurse and a former EMT. So that's my background.
And thank you so much. And wow, what a variety of experience you have and bringing to the table here. And welcome, Nancy Allen, if you would please share. I know we all know you, but please share.
Oh, absolutely. Yeah, I said, I see a lot of old friends and new friends on here, and I said, I'm going to pop my video on just for a minute so everybody can see big hair don't care, right? That's what coronavirus is doing. So nobody can get to the hairdresser. I am the Executive Director for the National Consortium for Health Science Education. In my first life, I was a registered nurse, well, still a registered nurse, right? Maintain our license. Had an opportunity to serve as the health science state leader in South Carolina and also work with HOSA Future Health Professionals. But the consortium is a collaborative supporting teachers down to the classroom level, and really appreciate Linda inviting us to be a part of this panel today.
Thank you so much, and we are very lucky to have both of you on this this conference so that you can share experiences, and we're going to get right to those questions. So the way that I'm gonna start, I'm gonna ask the question, and then Dana, if you will give your answer, and then Nancy, and if you have any questions, we're going to monitor the chat and address those questions at the end. Okay, unless there's something burning, and we'll try to address that as well. Okay, so the first question is, given the extremely challenging times we are in, please tell us what you feel is most important for teachers, leaders to be doing right now.
For me, I think the most important thing right now is to try to return some form of normalcy to our students, to try to keep them motivated to learn, which is hard while they're worried about other things. Keep communication open, help the kids towards their next step in their careers, because this is their next step. They're not going back to the classrooms at this point, so we need to prepare them for their next step. Make sure they understand that they are not just a job, that they matter. Whether they're in the classroom, brick and mortar, or not, they matter. I think, obviously, as the HOSA chair-elect, I think HOSA is one of the ways we can keep some normalcy. They can do it virtually, but they can still have meetings. It's student-led, so it kind of takes the focus off of them and makes them feel more like they're doing the normal activities of being a senior or a student.
Thank you very much. And Nancy, same question. Would you like me to read it again, or?
No, I have it. That's fine. So I think that as teachers, we focus on we focus on Bloom's taxonomy, and at this time, we might really need to think about Maslow's hierarchy of needs. The teachers really need to follow their individual state recommendations for grading and assignments, and just really think about reducing the number of assignments because of the inequity of the internet access and also digital devices. Not to mention the stress that the families are likely under. It may be food insecurity issues or maybe just fear in general. So meaningful connections with the students are really important, and the number of assignments that they turn in is really not the most important thing. Our high school students may even be caregivers for their siblings. They may have household duties that they're having to do as well as their schoolwork. And really think about it. In some of these families, there may be only one device, and they may be all using that device to work, to do school. And so students really need to, not be so stressed about that type of thing. Some states in school districts, they have one device, they're one-to-one device for students, but some have no devices at all. So students may be using their phones to do their schoolwork. So teachers absolutely cannot make one plan for assignments that will work for all the students. We need to, as teachers, kind of be easy on ourselves and avoid comparing ourselves and our students to other programs. Consistency, connection, and grace, really grace at this time, because our schools are really the safe place for our students, and now it's a virtual space. So don't be too hard on yourself, and don't be too hard on your students.
Wonderful advice from both of you. And just one thing to add on to both of your statements. Yes, the students matter, and the connection is really vital at this time. And if, we have to remember that other teachers are giving assignments as well. As much as I like to think I'm the only subject that they have, and I know we are the most important subject, just saying, but we want to make sure that we're not overloading them, and it's easy to do because we're just typing in an assignment and it seems good to us. And so really I truly believe in both of the statements from Dana and Nancy, the consistency, connection, and grace, and letting them know that they truly matter. So thank you for that. Okay, our next question is, how is your organization creatively dealing with the hands-on or kinesthetic learning that is fundamental to the health science programs?
You want me to answer first?
Yes, we'll keep that format, Dana and Nancy, if that's okay.
That's fine. For us, we are allowing each school system to make a plan that is best for their needs, because, as Nancy said, some of our school systems have better access to technology than others. And so they have to make a plan that works for their local area. But all of our schools have plans that include technology and make accommodations for students that don't have access to technology. With our hands-on, when they have the virtual technology, a lot of our teachers are doing the Zoom meetings and demonstrating the skills, walking the kids through the steps. They're having the kids create pictures of themselves performing the skills with simulated items at home, making a presentation out of it, where they're explaining the theory behind each step in the skill. Some of them are having the student zoom in and they're observing the student do the skill. We have some schools that have agreed for some of the smaller pieces of equipment like bedpans and TED hose and gate belts that they gave them all to the seniors, because we have pickup days for packets. So they signed them out and gave them to the seniors, told them, we'll purchase you new equipment next year. This way the kids have the equipment at home to work on it. We do have some teachers that are even checking out CPR mannequins, some of their older CPR mannequins, and they're watching the students through Zoom do those skills. It's much harder when the students do not have technology, because you don't have that one-on-one question answer that you can correct them while they're doing it and observe it. So that does make it harder. But our schools have gotten extremely creative with getting the hands-on portion of this accomplished. HOSA also has a lot of resources that assist in the leadership and career instruction area. Not so much hands-on because of the equipment, but with their structured program of work, with job seeking skills, prepared speaking, you can use a lot of their resources and integrate it and incorporate it into lessons that you send home with kids, either through packets or technology.
Very good, thank you. And Nancy?
So the consortium has always had the National Health Science Standards, and we have a work-based learning resource that's available on our website. Of course, that is for purchase, but there would be opportunities for your students to do one of the HOSA competitive events, health career exploration or health career display, that your students could do that. But I know you're specifically asking about skills and hands-on, but when you're thinking about work-based learning, if they have to research a career and maybe do a project that you could, if your students had technology that you could see through Zoom. But most importantly, I would say, and I mentioned this in the first question, you really need to check, if this is for certification, then you really need to be in close alignment with your health science state leader or whatever government agency may provide oversight for certified nurse aide, home health aide, patient care tech, because they probably have some. And remember, everyone on the planet is affected by this. So I'm sure that they have some experiences that they've gone through and online simulations and what they will approve as far as video conferencing and remote learning. So I would just encourage you, in addition to everything that Dana said, is to make sure that you find out what the regulations or the requirements are going to be for your state. We also know that some teachers may be planning some makeup summer sessions, because we will get through this, right? We're all in this together, and maybe there's some summer sessions or some way that they can make that up. But obviously, a video conferencing and Zoom would be a way to do some checkoffs. Using doll babies, using family members, that type of thing could also work.
Yes, exactly, and thank you both. For my organization, we were shut down and not able to go back in, and that's the case for many of us. And our district did allow me about 15 minutes because I whined really loudly, and I was able to obtain a mannequin. But prior to that, I was using the baby dolls and things like that. But one question that I know some of the feedback that I'm getting from members and just questions, how if you are lending things, you have to also consider, when you get them back, a decontamination procedure of cleaning these items, including, we've been lending laptops and Chromebooks and you name it. And so now the next thing to think about, the next steps are, when we do go back, and we will, I agree with you, Nancy, this will end, there is hope in sight, but we have to think about the decontamination of these items as well, from the laptops to the mannequins and whatever. So that's something to consider. Thank you both so much. So the next statement, with the health science programs, hours for certification, eligibility are important. What is your advice here? And this is probably the question of the hour for everybody. So Dana, and I'm gonna
we have been in contact with a lot of the credentialing agencies. Many of them are working nonstop trying to find accommodations or modifications to maintain the integrity of the exam, as well as work within the restraints of what we have going on right now. Some of them are better able to do that than others. We have, if it's a test, we have a lot of them that have gone to live remote proctoring. So the kids are going to be able to sit for the test at home, being observed by a live proctor. The ones that we are having a little difficulty with right now are the main one's CNA. We credential probably 600 to 700 CNAs through health science each year. And many of them were able to get their 16 hours in before the long-term care facilities went to essential personnel only. and many of them were not able to. So what our plan is to partner with the long-term care facilities in the area, and as soon as the restrictions are lifted, then our students will go in, even if school is out, if it's June, the students will go in, they'll do their hours, and the long-term care facility will test them through their CNA program. And it's just for this year, but it's an agreement that a lot of our teachers are able to make. The long-term care facilities are very willing to work with us on that. Our BLS instructor is another one that's a little more difficult because you have to do a teach back in a class. Well, we can't bring people together right now. So that's another one that they have extended the length of time to get this done to 10 months. So once the students complete the program, which they can do through Zoom, we can do that very creatively. Many of them have already completed the program, they just haven't done their teach back. So with that 10-month extension, I think we'll be able to do that. Our students are going to have to be very diligent, and they're going to have to come back after all this is over and complete the process. But I'm very, very proud of all the credentialing agencies. They are working very hard to make accommodations, but maintain the integrity of the exam.
In addition to everything that Dana said, you may want to think about other ways that you could provide certifications for your students, kind of deviate from your original plan. I know Career Safe, they do an completely online OSHA healthcare certification. It is $25, but maybe if your students were going to be paying more than that for a CNA certification, that would be another resume builder for them that they could do online. It's all created. The teacher would just, be able to connect the students through Career Safe. Career Safe is also offering some free opportunities. They're one of our partners, one of the consortium partners, and I think they're doing for people who are already customers, they're doing a soft skills certification that at no cost. Microsoft has some certifications online for medical administrative office, so you may want to consider that. And then Pass Assured offers a pharmacy technician training program, but it really is pharmacology across all health professions. So there's lots of science and math in that program as well. And so that's all online, taught by a pharmacist. The teacher actually is just a facilitator and releases the student to move through the curriculum as they're successful on quizzes throughout the program. And they're offering that at a 50% discount. So I just encourage you, if you're not a member of the, or if you're not following the consortium on Facebook, that we every day or every other day, anytime we see something out there from our partners, or our partners reach out to us to say, we want to be helpful. We know that there's a lot of stress because teachers aren't able to certify their students perhaps in the ways that they had hoped. And so if you go to the consortium's Facebook page, you'll see that there's kind of a continuous feed of opportunities there, as well as our Health Science Educators Association. They have a Facebook group, and you don't have to be a member to be a part of that Facebook group. It's free. And so teachers kind of dialogue there. So it's Health Science Educators Association. So you're welcome to join that group and also get some support and maybe some ideas about how others might be handling certification. So, and then lastly, if you go to our website, which is healthscienceconsortium.org, and I'll put it in the chat here, /webinars. We have done a couple of webinars that where teachers, health science teachers, talked about how they're doing skills and what programs they're using. So you can see we did a virtual camp this past Saturday. It's a 4-hour recorded session there with some PowerPoints from all the presenters who were health science teachers, as well as other resources. And then on March 18th, we did a webinar for health science state leaders as well as health science educators. And you can go there, and we created a Google Drive with tremendous amount of resources, best practices lesson plans. And when I'm quiet here in a moment, I'll put these websites here in the chat. So we have really tried to support teachers. We know that everybody's trying to be really creative, but there's a couple of opportunities that you may want to offer for your students outside nurse aid.
Excellent, thank you. And I kind of glanced at the chat questions. Being from New York, we do use Prometric, as I know other people do. And I just was on a meeting with our New York State Health Science Educator Board. And I did ask Louise, who is our NICED representative, what's going on with Prometric. And basically, right now, everything is on hold, and they're still, they're going through the same decision making as districts are. So it's you wait 2 weeks. They did send surveys out to all of the people who have put in requests for days. So if you have not received your survey, I would definitely reach out to Prometric and just, remind them, with an email like we did put our days in, did not receive the survey. In the survey, they do ask, when do you expect to go back to school? And that's, the question of the day. When do you expect to go back to school? I know my testing is May 4th. I do not think that will be happening. And in order to make up the days, they are talking about the utilization of regional sites, as well as if you are able to get back into your classrooms. So everything will be pushed back. It will happen. There's no, you don't forfeit the fees or things like that. It will happen. It's just like both Dana and Nancy said, it may not happen now, it may happen during the summer hours. And that's, something for districts and schools to consider. I will move on with the questions. This is all very, very good and very helpful. I did participate in the consortium webinars right from day one when we first went into this crisis, and I will recommend them. They are very good, as well as ACTE does have a full page of resources, webinars, and a lot of information. So do reach out, and HOSA does have some information as far as resources. And Dana and Nancy, I appreciate if you do share your website information and any other information in the chat for our participants to record down. Our next question, we are up to questions specifically surrounding the CNA courses, that CNA courses involving the hours documentation. What would you recommend to teachers in regard to skill competency, hours documentation, and the record keeping end of it all?
A lot of that we kind of covered in the last question. I may have answered a little ahead in the last question. But I spoke multiple times with the Alabama Department of Public Health yesterday. And we were trying to work through a lot of this, and they are perfectly okay with the teachers continuing to teach, continuing to check off skills. The only way right now we can do that is through technology, because our students are not allowed to come into the classrooms at all. And so the largest majority of our teachers, that's how they're continuing to do their CNA certification or getting them ready for certification, is through the skills portion at home, simulation with medical equipment at home. Some of them have issued projects like, well, one of them is kind of related to CPR, but her project is the student creates a simulated AED. So they have to recognize what each one of the buttons are, make sure every one of them's there. They have to recognize the cords, where they go, and they're making it out of shoe boxes and things like that, but that's fine. They're understanding what the equipment is, what the parts and pieces of the equipment are, and then they're using it on a simulated whatever. It could be a CPR mannequin, it can be a teddy bear, but they're using it and practicing and demonstrating to the best of our ability. We do understand that there is a little bit of leeway right now for checking off on a mannequin that shows perfusion. You know, we can't do that right now, but the teachers can check off and they can observe the procedure and the processes. So they've done skills that way. And they're continuing to document the hours, they're continuing to cover the content, they're continuing to cover the skills. We just have to wait on the clinical hours and the actual credentialing exams.
Thank you, Dana. Nancy?
Yeah, I don't think I have really anything different to add to that, except for just a reminder about following your state regulations and guidelines, because we know that those could be unique across the nation, and we, as teachers, we have to stay within those guidelines.
Absolutely, absolutely. And I've been, you know, in New York, they did reduce some of the hours, but we're still responsible for some. So I will reiterate what you said. Please check with your states for the specifics on that. Thank you. And so questions and discussions are happening regarding work-based learning. And what advice do you have in this area?
With work-based learning, we are again turning that over to the local education agencies. And it is a parental and a student decision. If they're being paid, if it's their job, it is between the parent and the student to determine whether they want to continue that job and if they feel safe in that area. We are not requiring students to attend work-based learning activities. Again, this is a state decision. And so again, I would go with Nancy on that. You need to make sure you know what the regulations are in your state. Our state reduced the number of hours required based on the amount of time we had prior to the students being out of school. But if it is a paid position, it is up to the parent and the student to determine if they want to continue doing that. Now, our internship experiences have stopped. Our non-paid educational internship experience, we have stopped all of those for Alabama.
Okay. And Nancy, anything to add there?
Okay, I would assume that these experiences have probably stopped all over the nation. Okay, so I would think that we just need to think about low tech versus high tech, and maybe there's ways that your students can do some work-based learning experiences. I'll put this link in the chat, but there's a website called BeSomethingAmazing.com, and it was produced by the South Carolina Hospital Association, but there are lots of interviews with health professionals there, and there's also explorehealthcareers.org, which we partner with, and they do a health professions week every week. I think it's in November. And they partner with 20 different associations that represent health professions across the nation. And so while it's not as good as your students actually being there and touching and feeling and walking alongside a health professional, we know that every student will have an asterisk but beside this moment in time, right? And so we can't expect that they're going to have the same experiences, but we could, provide some ways, if they have internet access, to do some research, some walk alongside health professionals so that they start to understand. And that's really what we think the goal of work-based learning is, right? So that we get them in the 9th grade, they're interested in health science, but they may not know what profession it is. And so by the time they get to be seniors, the work-based learning is like the icing on the cake, right? That they get to go there and be with the nurse or be with the dental hygienist. And so they start to kind of narrow their focus so that when they leave us, they move on to a post-secondary program, understanding a little bit about the profession that they've hopefully chose. So there's just going to have to be other ways to do that. And it's going to, it's not going to be on site. And I think that that's just going to be across the board, not just unique to one state. It's everywhere.
Exactly. And one of the things that we've been talking about in my little general area of health science is having students follow you know, what's going on, or follow a friend or a relative that is in the health profession through Facebook, you know, follow along, you know, a day in a life of what's happening in this critical situation. Because as Dana, both you and Nancy mentioned, this is going to be their life, and this is part of preparing them. It's the best lesson on infection control that anyone could possibly give. Best lesson on learning, you know, the organization, CDC, WHO, and how task force is set up. So I think that WorkBased will come along through this experience, but like you said, you know, definitely not in the workplace itself. Okay, now something about a student question. So handling student questions can be difficult. What advice do you have for teachers as they provide support and answer the unanswerable question surrounding graduation, prom, testing, completion ceremonies, pin ceremonies? These are tough times and these seniors are feeling it. So what's your advice there?
They really are feeling it. My advice right now, they need somebody to listen to them. They need somebody to hear them and hear their voice. We don't have the answers for them right now. We don't know if they're going to get to have a later prom or a later graduation. We don't know. We can use it as a teachable moment in the classroom. The grieving process, we can help them understand what they're feeling and why they're feeling it. The grieving process is one of the things we should be teaching. And it's not necessarily about losing a loved one. It's about losing something that was important to you. And what's more important to you than the end of your senior year, when all these first and these milestones are supposed to be happening and you feel like they've been taken away from you? They're grieving. So this is a good time to teach them about the process and what they're feeling and why they're feeling it, and that it's okay. And it's a time to listen to them and let them know that what, you know, as adults, sometimes we look at it, prom is, well, you know, okay, so they're missing a dance. Well, it's not. It's their senior prom. It's a big deal. And we need to let them understand that we know that this is important to them. And that they are, you know, they're a class of firsts. They already have built in their I went to school in the snow, walked uphill both ways story for their children. They already have it ready. It's done. It's made for them. They get to tell that for the rest of their lives. But they're a class of overcomers. And we will help them overcome, and no pandemic is going to be strong enough to silence them. Their contributions will matter. And we just need to make sure they know that. And there is the possibility through HOSA that we can give them a little bit back. If they have their reporter create a digital scrapbook of all the things that they were able to do through the year, and then provide that link to that digital scrapbook and do it during a Zoom meeting, and then all of them have the pictures and they have the memories of what they were able to actually do through the year. Instead of focusing on what they're not able to do, let's focus a little bit on what you did accomplish. And then maybe we could do a digital scrapbook or a digital tribute to the seniors and include pictures of all of them as they're doing their skills, because I know we were taking pictures in those classrooms, and we were taking pictures during the community service projects and that type thing we were doing through HOSA. Let's put that together and make a tribute to these seniors and continue to make it a big deal and remind them of what they have accomplished.
Okay. Nancy?
Okay. I think we can't make them promises that we can't keep, right? Because this really is just day to day. But we can celebrate with them. You can celebrate their accomplishment with creative solutions. Maybe they will be able to have ceremonies at a later date, but we can't make false promises. So maybe it's reaching out to the parents and just, you know, saying they're doing a great job. We're going to get them through this. they will be stronger because of this. They definitely will be more mature and stronger. Don't be afraid to talk to other teachers. And I know if you watch the news, you've seen how teachers are going through neighborhoods and blowing horns and, you know, celebrating that way. And so perhaps that's an option. You could do digital posters that you could email to the students. So don't be, and a phone call, an email to parents, just bragging on their students. It really is up to us as teachers to be encouragers. And I know it's hard for us sometimes too, because we get kind of down, you know, just trying to navigate this whole pandemic.
Yeah, well said, both of you, and I totally agree. And districts are putting together things like videos, as well as, you know, just I'm thinking of you type of things. One thing that we did, it was actually the Friday of the first week, I had everybody, we do Google Meets, just, you know, open chat type of thing, and they wore their uniforms that day. So we were all in solidarity as healthcare professionals, but also with those that are actively working, telling them, you know, this, you know, you are getting stronger because of this, you're learning more because of this, and, you know, we will get through this. And I love the ideas that you guys both shared with us, and I'm seeing so many more in the chat, so this is great. In regard to the students, what support can HOSA and the National Consortium offer for the students?
HOSA has a National Executive Council that is made up of students that have just graduated high school. They also have a secondary member. They are available through social media at any time. They have been very responsive to our students. We've had a lot of students reach out to them, and they are amazingly supportive. They're just out of school, so they completely understand where these kids are coming from. HOSA itself has made a commitment that nothing else is going to be taken away from the class of 2020 that they can provide. So they are in works right now to make sure that we are going to continue to have an International Leadership Conference in June. Our students have worked very hard to earn competing at the international level, and they have made a commitment that they're going to be able to do that. It may not be in the traditional manner. All of the details are not worked out yet, but I can guarantee you that there is a crew working diligently to make it happen. They are working to make sure that they have the general sessions, that they have the competitive events, that they have a way to network and socialize, even if it has to be virtually. They're going to find a way to make this happen for the class of 2020. I would suggest to have the students, encourage them to keep checking the HOSA website, and it's hosa.org. And all updates about ILC will be posted there first. And any questions they have, they can use the Contact Me on the HOSA website. They can contact their state officers, or they can contact the National Executive Council. They can also contact the board members. They can contact me directly if they'd like to. We were willing to help any way that we can.
Thank you. And Nancy.
Okay. Well, obviously we hope all your students are HOSA members, but we know perhaps some are not, but we don't want to really think about that. But just wanted to remind you that these students are very, very comfortable with social media. Okay. So they've been doing this a lot longer than we have. So
I am so sorry.
What's that?
I am so sorry. Dogs. Sorry.
Oh, okay. So you know, just encourage them to be in contact with each other, supporting each other through social media, through Google Hangouts, or through Zoom. I know everybody is on Zoom overdose right now, but just ways for them to connect and be supportive of each other, whether it's through a CTSO, which we strongly support, or whether it's just through being a community, being a classroom and being a community. Because, you know, as much as they thought they didn't like to go to school, they'd give anything to go back to school right now, right? I know I would give anything to a little more to get to see my friends face to face. So any way that you can support them through that, whether it be through HOSA or just the encouraging of having your class together in some ways.
Yes, well said. They didn't want to be in class, but they sure do want to be in class right now. One thing that I can say, definitely the HOSA connection, so important. There's a lot of support there, but also the consortium. Nancy is the webinar. There was a webinar on blood organ donors. I mean, check out the webinars because they are recorded, and you can actually use that as something that your students can look at, in a way of keeping them in the loop of the whole, you know, seeing what organizations are. It's a good learning moment for what is out there as far as support. We as educators have membership organizations, so kind of a learning opportunity as well as a good lesson, some of the webinars that are available. So on to our next question, and I believe that we did hit this, so if there's anything more you want to add. Teachers are struggling with the certification questions, and what insight can you provide in this area? And I believe we've answered that. Dana, was there anything else?
No, I added a link to a Google document that Alabama put together for our teachers regarding the credentialing agencies that we use and which ones are doing live remote proctoring, which ones are not. So if anybody wants to use that as a resource and see if their credentialing agency is on there, they're welcome to use it. I did put the link in the chat.
Thank you. And Nancy, anything that you have to add on that one?
No, I think we've covered that.
I agree. And it seems that everyone has come out of the woodwork to share their resources related to distance learning and otherwise. Some are stronger than others. How do we as educators decipher quality from non-quality?
We are using our proven partners. ACTE, the resources that they list are proven partners for them, and the consortium, the resources they list are proven partners for them. HOSA has a multitude of partners that have worked with them for years, and there is a list available on their website, and I'll put that link in the chat as well. And each one of the logos is a link to that resource. And so that's what we have done. We have a lot of, like you said, there's a lot of information coming in right now, and we have chosen to use our proven partners.
Thank you. Nancy?
Okay, I would just echo what Dana said. We, if you look at our webinar that's recorded on March 18th, there's a PowerPoint there, and one of the slides has a link to all of our partners who have offered free trials or complimentary text online, so textbooks online. So all that is there, and they are members of the National Consortium for Health Science Education of our publishers and educational resources category. So we're confident that what they have is quality. We are hearing from other providers who have resources to share as well, and so we will put them on our Facebook page, and you're welcome to kind of vet those yourself. We did get a free movie from a I think the man is a physician, but you'll have to, if you go to our website, it's also on our Instagram and Twitter. But it was a movie about this man's search for a cure for cancer, and there's all kind of supporting resources that you could have your students watch the movie. It's free, and then use those resources as a lesson plan. And just to what Linda said, we did have a great webinar on April the 1st about organ and tissue donation. Every student that you teach, when they go to the DMV, are asked a question about whether they want to be an organ donor. And so this, we had students on this webinar as well as teachers. And so I invite you to go there and maybe have your students go there and maybe do 2 or 3 questions for them and let them, let that be let that be an assignment for them. Not too much work for you, but very good information for them. So we feel good about our partners. We appreciate how America has really come together, and we've just seen outpouring of information and people that really want to support teachers down to the classroom level during these unprecedented times.
Yes, thank you. And again, I will support exactly what Dana said, Nancy said. ACTE does have a whole volume of resources. It's very easy to navigate and very easy to obtain. As Nancy at the consortium, those slides, I was at that session, that webinar, and took away a lot. And there are some vendors that are going to approach you, but I would use caution. Go with the tried and true. Go with those names that you know. So we really want to be careful with what we choose, and stick with our resources. ACTE, HOSA, and the consortium are our three big resources that will provide resources for us. So seek those out. I'm going to skip over Nancy and Dana. I'm going to skip over that number 11 because we've hit it, about the skills. Let's see. Educators and learners are usually more adept at using technology and distance learning than others due to the expansion of this type of delivery over the past 10 years. However, how do we quickly bring those who are not familiar up to speed?
Well, our partners have been amazing. We pool our resources and provide a consistent message in our professional development to our teachers and our learners. ACTE is offering free courses on remote teaching. The consortium has offered remote teaching camps and webinars that we've had great responses from our teachers on those, Nancy. HOSA is offering additional HOSA Tall Bronze course for new advisors on how to integrate HOSA and how to use HOSA and what resources they have. The National Board for Professional Teachers has provided a list of resources. The National Health Career Association hosted a remote teaching webinar for teachers. They also have online resources, Pharmaceer, which is online curriculum for the pharmacy technician certification. And they have a new online curriculum called Personability, which is for soft skills. So they're a proven partner for us. Many of our partners have made their resources free. ICVE, or ICEV, I said it backwards. They have offered up their licenses for free for the rest of the school year. I know they have CNA resources and veterinary science resources. We don't recreate the wheel. We just need to use our current proven communication methods, make sure our education, our resources gets into the hands that need them.
Excellent. Nancy.
Okay, I think I mentioned this early on, and that is not to be too hard on yourself as teachers, not compare yourself, but to reach out and encourage each other, and don't try to go from 0 to 100, in 3 seconds, because this is a big learning curve for all of us. And certainly we're going to be better at this. And we know that really blended learning, where you do distance and face-to-face, is probably best, but we don't really have that opportunity to do that. Go to YouTube and search for the technology skill that you need. There's lots out there. You'd be surprised. And just take it easy on yourself too, because you're grading on mastery and not so much, on the grade. And remember that we all think health science is the most important, but they have other courses that they're trying to take as well. And so just take it slow and be easy on yourself.
Exactly.
And Dana mentioned ICEV, also Applied Educational Systems, AES. They are offering free for the rest of the year as well. And they have CNA and medical assisting and other programs that you could jump on there and have your students see some skill observations there.
Yes, thank you, thank you. And I'm looking at the chat quickly, and Steve DeWitt, he posted about Accenture and Skills to Succeed courses, and a lot of what is posted on the ACT site, they're, you know, easy to obtain, easy to use. I know Nancy, in the Saturday camp, there was a lot about Google, and the best way to learn Google is just by playing around with it and trying it out. That's trial and error. That's how I'm learning things, and you know, I'm getting a lot better at it. But I do always explain to the students, we are learning this together, and they see that humble side of you. So that's something that's very important. The first day that I listened to a or actually was part of a webinar that the consortium was holding, the first thing Nancy said was, make sure you get washed and dressed in the morning. And I know we've all kind of figured out the halfway, you know, dress nice on the top and wear your sweatpants on the bottom, but that's okay. But the point is to get up and get dressed, because I think the first couple of days we all didn't know what to do and found ourselves in our pajamas at 5 o'clock in the evening. So do not be hard on yourselves, as Nancy said, and one thing at a time, go slowly. And there are, this is going down to our last, we're gonna start wrapping it up, but you know, there are silver linings, and I'm gonna turn to my panel, but I'm gonna say the one that I think is totally happening, and it kind of applies with this. There are so many people willing to help and support, whether it be a colleague, a stranger, you know, there isn't anybody that isn't willing to do something. We all feel at a loss. Especially, you know, I'm a nurse, and, you know, I am on that volunteer list for our state and for the, you know, for wherever, but, you know, we can help each other through things like this. That's a silver lining, and being, you know, a good model of what love one another truly means. So Dana and Nancy, we're gonna go to our very last question. What silver linings have you seen as a result of this crisis?
I want to echo what you said. Everybody coming together, everybody helping. There's a lot less blame going around. It's just, how can we help you make this happen? And everybody seems to be on the same page. I think when all this is over, I hope that we see a lot more respect for our teachers, a lot more respect for our healthcare workers of all areas, maybe a little more appreciation for the actual importance of the school environment itself, because right now we're seeing what they're missing by not being there when they expected to be there. So I'm hoping there'll be a little more appreciation for that. And on the personal side, more appreciation for family time and the importance of a steady income. These kids right now, you look at the people that are working right now, these might be careers you want to consider. I mean, this is a very important lesson right now. And, you know, for me, it's a whole new appreciation for nature. I realize I like to be outside a lot. I really do. And as much as I talk about people when I drive into work, I will drive behind somebody slow in the left-hand lane all day long. Just let me go be with people.
Yeah. And Nancy.
Okay, I was thinking about all that you all said. Certainly connecting with families. Family really is what's important now. And I just, as we sort of go through neighborhoods, we see people outside playing with their children, and, you know, everybody's yard's looking a little better. Those, you know, that's something visual that you can see. But think of the bright light that is now shining on health science education, right? That's a huge silver lining. We always knew how important our programs were. We always knew that we were preparing the next generation of health professionals, but now there's going to be people interested in what we're doing, right? And what a great time for teachers to ask for a raise, right? Because parents have had the opportunity to spend lots of time with their own children and really appreciate educators for all that we do. So think about how we are going to be able to promote our programs based on healthcare being in the forefront in this terrible situation where everybody is affected. I heard a reporter say today, I have never reported on something that affected everybody in the whole world. And that's what this does. But we can come out of this, and certainly it's going to be up to us to prepare these students. And just hang in there, teachers. Don't be too hard on yourself. Thank you for all that you do. And thank you, ACTE, for inviting us to be a part of this.
Thank you very much.
So much to our panelists, Dana and Nancy. We are so proud and happy to have you, and they are wonderful supports. Please, I want to just extend my gratitude for all of you that have attended today. This will be recorded, and Steve and Brandy, thank you so much from ACTE for arranging all of this. And I just love and prayers for all of you, and just we're going to be strong, and we'll do this together. Thank you so much, everybody.